What's up guys, it's Lindsay from Reidheads. Up until this point, most of our posts have been about our workouts, what exercises we do, the numbers of reps and sets that we do. However, we are wanting to expand our content and our type of post. Since I'm a registered dental hygienist, I find oral health super important. The mouth is the gateway to the body. So I wanted to do some posts to help educate, some tips and tricks for the teeth, for overall health that have to do with the mouth. So today I'd like to touch on Botox. Now, when most people hear Botox, I think it's safe to say they think of celebrities or people that have no wrinkles when they raise their eyebrows or puffy lips, which is correct to an extent. There is a cosmetic reason for Botox, but however, there is a therapeutic benefit as well. I'll touch on the cosmetic benefits in just a little bit, but I'd really like to focus on some therapeutic benefits that people can have from Botox. A lot of people tend to clench and grind their teeth, and this can cause wear to the teeth, which can cause the teeth to break. It can cause sensitivity. It can cause gums to recede. You have a huge muscle right here called a masseter muscle, which is one of the muscles of mastication that helps us chew. Sometimes at night, people aren't aware that they are clenching and grinding. So all throughout night for hours, this muscle is constantly working. And just like with your biceps, your thighs, any muscle, if you work it out, it can become enlarged. So people that are known to what's called bruxism, or other words, clench or grind, their masseter can become enlarged and they can kind of have puffy cheeks. Some other side effects from clenching and grinding is headaches, tension, migraines. You can get jaw problems with the TMJ. So Botox can help to relaxing this masseter muscle. So when you are sleeping, you're no longer clenching or grinding. Another alternative to a mouth guard. Mouth guards are not very comfortable to sleep with. They don't have good patient compliance. You have to replace them about once a year. With Botox, it is, everybody's different. Results vary from 3 to 8 months. So it's kind of similar to a mouth guard, it's not a permanent solution, but it is a short time benefit that can be achieved. A lot of people aren't aware that Botox can be an option for them for treatment for their clenching and grinding. An awesome thing too is some dentists do offer Botox in their office. A lot of people don't advertise it just because of the pricing and the misconception with Botox. They don't want people to think they're just trying to sell them something that is cosmetic. My boss, Dr. Davis at Rustic Mountain Dentistry, does offer Botox, and he has had great success doing the masseter muscle. There's another muscle called the temporalis that he can do some in. Some people have a lot of tension in their head. They get some Botox in there. It can help relax it, which yes, does help with wrinkles as well, which is just a bonus to it. So how Botox works is it blocks acetylcholine from being released, and acetylcholine is needed for the muscle to contract. Some people have explained Botox as the muscle becoming temporarily paralyzed, but a better way to say it is that the muscle can no longer contract, therefore relaxing it. But recently, I actually had some Botox. Growing up, I've had a gummy smile. Some of my upper lip muscles overreact, and so that causes my upper lip to go up too much when I smile, therefore exposing my gums. My Botox was a cosmetic reason. It wasn't anything therapeutic. However, when I went to hygiene school and learned that, the ideal smile rests just right above the teeth, and I noticed my gums were showing, I obviously wanted to do something about it. So Dr. Davis gave me just a very small amount of Botox.
A little bit easier. These ones are deeper muscles. Turn towards me a little bit. And bench. Sorry, 3. Good.
Is that it? I felt like within one day I saw results. I was happy with it, but it takes about 4 days to see the full result. So now when I smile, you're not able to see my gums. Again, this is just temporary. It could last anywhere from 3 to 8 months. With time and with more Botox, that is something that can become shortened as well. My results may not last as long after 20 years of receiving Botox. Now, there are different types of people that can offer Botox depending on the state and regulations. Some nurses might be able to, some estheticians with the right training might be able to. I don't believe any hygienist can, but again, it probably depends on your state. In my opinion, one of the best professionals that could do your Botox is a dentist. In dental school, they learn all about the bones, the muscles, the nerves, arteries, veins. They learn their locations, their origin, their insertion, their actions, what they're used for. They spend so much time learning about the head and neck that they know exactly what could benefit you, where it's at, the amount to use, versus some people just get like on the job training just really quick. They might not know all of the muscles and the anatomy of the head and neck. Of course, you can go to whoever you want. I would just look at their credentialing, their licensing, see what kind of training and schooling they have had to back up their use of Botox.